So, ladies and gentlemen, if you were following diabetes and obesity in the last couple of years, GLP-1 is a quite trendy, sexy topic. Why? Because GLP-1 is giving me satiety and fullness, so I don't eat that much and I will lose weight. At the same time, what it does, it can lower down my sugar, right? So every obesity conference, this part, yes, I am doing it. I do it intentionally. I am doing it. Yes, I am doing it. Because someone asked me to do it, and I'm doing it. So basically, as you can see here, if you go to any obesity conference or diabetes conference, GLP-1 is always there, right? The pharmaceuticals are there, right? And advertising their own medications for diabetes and obesity. Why? Because as you can see, we have something called incretins, or gastrointestinal peptides, GIP, or GLP, that basically it's abbreviation for glucagon-like peptide. Biochemically, it might look like glucagon, but functionality, it acts like insulin, right? So here, right, we call it glucose lowering peptide. We made it up. Our pediatrician, Dr. Vikram, made it up, right? Glucose lowering peptide, which is quite good. It's a peptide bringing down my sugar. Why? It stimulates insulin release, inhibits glucagon release. This picture is from Wikipedia, by the way, right? This is from Wikipedia, right? Because the first time that I heard about GLP-1 and DPP-4, I was panicking like you as well. It was years ago, but I was panicking. What the hell are they? And I found this, which is simple and great, because it gives me as much as detail as I need. And educational. Educating. Great. Stimulate insulin release. Sure. Inhibits glucagon release. The net effect is the same. Lowering down my blood sugar. Bingo. Right? Bingo. The whole thing is, incretins and GLP-1 has a short half-life. Why? Because there is an enzyme in the body called DPP-4 metabolizes GLP. So pharmaceuticals came up with a medication that blocks DPP-4. So it's a DPP-4 inhibitor. All the DPP-4 inhibitors end with gliptin. So I call them gliptins here, or we call them gliptins here. Right? Also, pharmaceuticals tried to actually make GLP as well, right? So, and medications called tides came to the market, which was a huge revolution in diabetes, because for years we were hearing about metformin and sulfonylurea and their cousins, right? But that was quite revolutionary in the treatment of diabetes. So, guys, GLP is my friend, right? DPP-4 is the enemy of my friend, which is my enemy. And DPP-4 inhibitors are the enemies of my enemy, which is my friend. Because the enemy of my friend is my enemy, and the enemy of my enemy is my friend. So GLP-1 medications came to the market that acts like GLP-1. It's GLP-1 receptor agonists, tides, injections, and DPP-4 inhibitors that basically that blocks the DPP4, so increasing the half-life of GLP, gliptins. End of the story. Is that clear? Is that clear? Dr. Hossein, I will talk about it in a second. Good that you mentioned. Good that you mentioned. Guys, is that clear? Is that clear? Guys, if insulin comes out of my beta cells, there is a tag in the body that you can track it called Cpeptide. Another time. If insulin is coming brand new out of my beta cells, there is a tag attached to it that you can track it. It's called Cpeptide. Cpeptide is a tag telling you that the insulin in your body belongs to your own beta cells. So if I make your beta cells produce extra insulin, the C-peptide attack is going up. If you have insulinoma, insulin is coming out of your own body, your C-peptide will go up. If I give you insulin from outside, straight insulin, exogenous, there is no tag. So C-peptide does not go up. That's it, simple and easy. If you know that, I think you can easily answer that question. If you know this, I think you can easily answer that question. The question was not that complex. The question was not that complex, the C-peptide question, but you need to know this much about it. Okay? So this is the story of the tides and gliptins. Tides are like GLP-1, and gliptins are enemies of your enemies, increasing the half-life of your GLP-1. GLP-1 is your friend, lowering down your sugar and makes you feel full, right? So that's why, because you feel full, some of you might say, how GLP-1 will cause weight loss, while it seems that it stimulates insulin release. It should give me weight gain, not weight loss. No. The thing is, GLP-1 makes me feel full, gives me the feeling of satiety, and slows down my guts. Because it slows down my guts, I feel full for a longer period of time, so I will not feel that, I don't feel that I'm hungry, so I don't crave food. So I eat less and I lose weight. The C-peptide question, the easy thing about C-peptide, if the insulin is coming out of my beta cells, there is a tag attached to it called C-peptide. That's it. It's very easy, very simple. If insulin is coming from inside my body, there is a tag attached to it called C-peptide. So insulin is high and C-peptide is high. It doesn't matter. It comes from an insulinoma, or it comes because you're whipping my beta cells to secrete more insulin. Sulfonylurea, for example. But if you give me insulin, exogenous, my C-peptide will not go up because it's not coming from my beta cells. That's the C-peptide. Done. Finished. We use this or. We use tides or gliptins. We use tides or gliptins. We use tides or gliptins. Right? As far as my knowledge goes. We use this or that. We use tides or gliptins. Okay. So I think